Imagine you're driving your car on a long highway. The windows are down, your favorite song is playing, and everything feels perfectly fine. Then, out of nowhere, a tiny red light flickers on your dashboard. It's not smoke, there's no loud bang, the engine isn't sputtering, just a quiet, persistent glow, blinking at you like it's trying to whisper something important. Do you ignore it because the car still feels fine? Do you turn the music up a little louder and tell yourself you'll check it next week? Or do you pull over? Here's the uncomfortable truth. Most of us treat our cars better than we treat our own hearts. We'll take the car to the mechanic the moment that light comes on. But our own bodies? We make excuses. We wait. We tell ourselves we're just tired, just stressed, just getting older. Your heart is the ultimate engine. It beats roughly 100,000 times every single day, pushing 5 liters of blood through 60,000 miles of blood vessels every hour, every day for your entire life. It never clocks out, it never takes a vacation, and it rarely, if ever, just stops without trying to warn you first. But here's the problem. The heart doesn't speak English. It doesn't send you a text message or book you a doctor's appointment. Instead, it speaks in whispers, a strange ache in your jaw, a sudden wave of exhaustion, a feeling of breathlessness that you chalk up to being out of shape, a flutter in your chest you mistake for too much coffee or a stressful morning. If you're waiting for what I call the Hollywood heart attack, that dramatic moment where someone clutches their chest and collapses to the floor, you might be missing years and years of quiet warnings your body has already been sending you. I am Dr. Martha, and in this video, I'm going to walk you through the 7 warning signs that your heart may be in trouble. I'm going to explain not just what these signs are, but why they happen, the actual science behind them. Because when you understand why, you stop dismissing these signs and you start taking them seriously. The first sign is a level of exhaustion that feels completely out of proportion to what you're actually doing. Now let me be clear, we all get tired. Life is exhausting. Between work, family, and everything pulling at us, tiredness is normal. But heart-related fatigue is a different animal entirely. It's heavy. It's unreasonable. It's the kind of exhaustion where you feel like someone secretly replaced your blood with wet cement overnight. Let me give you an example. I had a patient, a 58-year-old woman. Let's call her Diane. Diane was a teacher, fiercely active, the kind of person who walked her dog every morning and cooked dinner from scratch every night. She came into my office one day and said, "Dr. Martha, I don't know what's wrong with me. I went to get the laundry from the dryer, walked it upstairs, and I had to sit down on the edge of my bed for 10 minutes just to catch my breath." She thought she was just getting older. She wasn't. She had a significant blockage in one of her coronary arteries, a blockage that had been quietly developing for years. Here's what's happening biologically. When your heart is struggling, whether because of a weakened muscle, a developing blockage, or a valve that isn't working properly, it has to make very difficult decisions about how to use its limited pumping power. And the heart, being the incredibly smart organ it is, will always prioritize your brain and your vital organs. That's non-negotiable. Your brain gets its oxygen first, but that means your arms and your legs get pushed to the back of the line. Blood flow to your muscles gets reduced, and without enough oxygenated blood, your muscles literally cannot produce energy efficiently. It's like trying to run a factory on half the electricity it needs. Everything slows down. Everything becomes an effort. The specific thing I always tell my patients to pay attention to is new fatigue. Not the fatigue you've always had after a long day, but fatigue that showed up recently and doesn't match your activity level. Ask yourself, was I doing this same task 6 months ago without a problem? If the answer is yes, if you used to walk to the corner store without thinking twice and now it leaves you drained, that is your body waving a flag at you. Also pay attention to morning fatigue. If you're waking up exhausted after a full night of sleep, as if you ran a marathon in your dreams, that's worth noting. A struggling heart has to work harder just to maintain circulation, and that effort doesn't stop at night. Heart-related fatigue often comes hand in hand with a general sense of heaviness or brain fog. You might feel mentally sluggish, like you can't quite get your thoughts together. That's not laziness or stress. That's your brain not getting the full stream of oxygen it needs. The takeaway here? Fatigue is real. But fatigue that is new, disproportionate, and unexplained is your heart asking you to pay attention. The second sign is one that trips up even experienced doctors because it looks so completely different from what we expect heart trouble to look like. It's persistent indigestion, nausea, or a vague, unsettled stomach pain. I know, you're probably thinking, that sounds like a stomach problem, not a heart problem. And that's exactly why this sign gets missed so often. Here's the anatomy lesson that changes everything. Your heart and your digestive system are neighbors. They share the same zip code in your chest, and more importantly, they share the same nerve superhighways, specifically the vagus nerve, which runs from your brainstem all the way down through your chest and into your abdomen. Because of this shared wiring, when the heart is under stress, the brain can genuinely confuse the pain signals. It interprets cardiac distress as stomach distress. This is especially true for the lower portion of the heart, which sits right above the diaphragm, almost on top of your stomach. When that area is struggling, the signals it sends can feel indistinguishable from heartburn, bloating, or nausea. Women are particularly vulnerable to this misdiagnosis. Studies have repeatedly shown that women are far more likely than men to experience nausea, vomiting, and jaw or back pain as their primary heart attack symptoms instead of the classic chest pain we all picture. This is one of the main reasons women's heart attacks go undetected for longer, and why women statistically have worse outcomes. The symptoms don't fit the textbook, so they get explained away. Here is the key question I want you to ask yourself. When does this indigestion happen? Real indigestion happens after meals, after a heavy, spicy, or fatty dinner. It has a clear trigger. Heart-related indigestion happens during exertion or emotional stress. If you feel nauseous or uncomfortable in your stomach when you're climbing stairs, hurrying through a parking lot, or even during a stressful argument, that is a critically important distinction. Your heart is under demand in those moments, and it's struggling to keep up. If you've been reaching for antacids every day and nothing seems to fully help, if the discomfort doesn't respond to dietary changes, if it wakes you up at night, please don't just assume it's your diet. Get your heart evaluated. It could save your life. The third sign is what doctors call referred pain, and it is one of the most fascinating and most dangerous signs because people almost never connect it to their heart. We've all been taught that a heart attack means chest pain radiating down the left arm, and yes, that happens, but that's not the whole story, not even close. Think of your heart as a crowded concert venue. When the music gets too loud, when the pressure builds, the sound doesn't just stay inside the building, it bleeds out into the parking lot. The surrounding neighborhood hears it. Your heart's noise, in this case, is nerve signals, and those signals travel in unexpected directions. They travel up into the jaw, into the neck, into the left or right shoulder. They radiate down into the upper back, between the shoulder blades, and because these are areas where we commonly experience muscle aches and dental problems, we almost always explain them away. I want to tell you about a patient of mine, a 62-year-old man, a retired contractor. He came to me complaining about a persistent toothache in his lower left jaw. He'd already been to the dentist twice, had x-rays taken, been told there was nothing wrong with his teeth. but the ache kept coming back, particularly when he was walking uphill or carrying something heavy. That pattern, pain that appears during physical exertion and disappears at rest, is an enormous clue. That's your heart crying out because demand exceeds supply. Blood can't get through a blocked artery fast enough when you push your body, and the resulting pain travels along nerve pathways to distant locations. He did not have a dental problem. He had significant coronary artery disease. The character of this referred pain is also distinctive. It typically isn't sharp. It's not a stabbing, shooting pain. It feels more like a dull, heavy, pressured ache, like someone is sitting on that part of your body. It might feel like muscle tension, like you slept in a wrong position. It might feel like tightness in your neck that you assume is from stress. The question to ask yourself, does this ache come and go with activity? Does it appear when you exert yourself and ease off when you sit down? Because that pattern, exertional onset, rest relief, is a classic hallmark of cardiac pain, wherever in the body it shows up. Don't let a distant ache go unexplained. Sometimes the heart's distress signal is reading your jaw, your neck, or your back. Sign number 4 is shortness of breath, and specifically, shortness of breath that doesn't match the situation. Your heart and your lungs are the ultimate dance partners. They are in constant, synchronized communication. The heart pumps blood to the lungs to pick up oxygen. The lungs hand off that oxygen to the blood and send it back to the heart. The heart pumps it out to the rest of your body. This cycle runs 24 hours a day, 7 days a week. Now, what happens when the heart isn't pumping efficiently? Blood can't move forward. Think of it like a traffic jam on a one-way street. If the cars at the front aren't moving, everything behind them backs up. Blood starts to back up in the vessels leading from the lungs to the heart. And when pressure builds up in those vessels, fluid gets forced out through the vessel walls and into the tiny, delicate air sacs in your lungs, the alveoli. This condition is called pulmonary congestion, and it makes breathing feel like trying to breathe through a wet sponge. Your lungs are literally partially waterlogged. The shortness of breath that comes from this isn't the same as being winded after a sprint. It's a heaviness, a labored quality. You might notice it while talking on the phone, while climbing a gentle set of stairs, or, and this one is very specific, while lying flat. There's a condition called orthopnea, from the Greek words for straight and breathing, where people find that they can only breathe comfortably when sitting upright or propped up with pillows. When you lie flat, gravity is no longer helping keep that backed up fluid away from your airways. It pools in your chest, and suddenly breathing becomes difficult. People with orthopnea often don't even realize they've started sleeping with more and more pillows. It happens gradually. I'll also mention a related phenomenon called paroxysmal nocturnal dyspnea, which is a frightening experience where you wake suddenly in the middle of the night, gasping for air. You sit up, you try to breathe, your heart is racing. It usually passes in a few minutes as the fluid redistributes when you sit upright. Many people describe it as one of the most terrifying experiences of their life. If you find yourself unable to take a full, satisfying breath without real effort, if you feel breathless after activities that never used to wind you, if you need multiple pillows to sleep, your heart may be struggling to keep fluid moving where it belongs. The 5th sign is swelling, specifically in your lower body, feet, ankles, calves. Medically, we call this peripheral edema, and it's one of the classic signs of a heart that is losing its battle against gravity. Here's the physics of it. Your heart is a pump. Part of its job, a very important part, is to pull blood back up from the lowest reaches of your body. Your feet are the furthest point from your heart, and getting blood from there back up to your chest requires real pumping force. When the heart weakens, that return journey becomes too difficult. Blood begins to pool in the veins of your legs. Pressure builds inside those veins, and eventually the excess fluid gets pushed out through the vein walls into the surrounding tissue, and that tissue swells. Now, some swelling in the feet is normal, especially after a long day of standing, after a long flight, or after eating a particularly salty meal. But there are specific qualities to cardiac swelling that set it apart. First, it tends to be persistent. It doesn't fully go down overnight. Second, it tends to get worse as the day progresses and better in the morning after you've been lying down. Third, and this is a quick check you can do yourself right now, press your thumb firmly into your lower shin or ankle and hold it for about 5 seconds, then release. If a deep indentation remains, a pit in the skin that slowly fills back in, that's called pitting edema, and it's a meaningful sign that fluid is accumulating in the tissue. Watch also for swelling that leaves deep sock marks on your ankles, or shoes that fit perfectly in the morning but feel tight by afternoon. Swelling can have other causes: kidney problems, liver problems, venous insufficiency. But if it's persistent, progressive, and especially if it accompanies any of the other signs in this list, a cardiac cause needs to be ruled out. The sixth sign lives in the heart's electrical system, and it's one of the most underestimated. Most of us have experienced that occasional thump or skip. The heart does a little extra beat after you've had too much coffee or after a sudden fright. That, on its own, is almost always harmless. But I want you to distinguish between an occasional harmless flutter and something more significant. What concerns me is when the heart feels like it is flopping like a fish in your chest, or when it suddenly races at a high speed, 150, 160, 180 beats per minute, for no apparent reason while you're sitting calmly on your couch. Or when you feel like your heart is beating in a completely chaotic, disorganized way, not just fast, but irregular. The most common culprit behind this kind of irregular heartbeat is a condition called atrial fibrillation, or AFib. In AFib, the upper chambers of the heart, the atria, stop beating in coordinated rhythmic squeezes. Instead, they quiver, they tremble. Hundreds of disorganized electrical signals fire at once, creating a chaotic, ineffective fluttering motion. Now here is why AFib is so dangerous, and why I want you to take it seriously. In a normal heartbeat, blood gets pushed efficiently from the upper chambers into the lower chambers and then out to the body. In AFib, because the upper chambers are just quivering rather than contracting properly, blood can pool in the corners of those chambers, particularly in a small pouch called the left atrial appendage. Pooled blood clots, and a clot that forms in the heart can be ejected into the bloodstream and travel directly to the brain, causing a stroke. AFib is responsible for approximately 1 in 4 strokes. That's not a minor arrhythmia, that's a serious condition. There are also other arrhythmias: heart blocks, ventricular tachycardia, bradycardia, where the heart beats dangerously slowly. If you feel a palpitation followed by sudden weakness, lightheadedness, or a brief sense that you might lose consciousness, treat that as a medical emergency. A wearable heart monitor, even a consumer smartwatch with ECG capability, can sometimes catch these episodes when they're brief and not happening in your doctor's office. If your heart ever feels like it's playing its own unpredictable drum solo, get that electrical system inspected. The seventh and final sign is dizziness, lightheadedness, or that terrifying sensation of graying out, where the edges of your vision start to fade and you feel like you're about to lose consciousness. Your brain is an oxygen hog. It makes up about 2% of your body weight, but it consumes roughly 20% of your body's oxygen, and it is profoundly intolerant of interruptions to that supply. Even a brief, momentary dip in blood flow to the brain, a matter of seconds, can cause lightheadedness, visual changes, confusion, or fainting. Several cardiac problems can cause this: a heart rate that drops too low, a valve that is narrowed and can't let enough blood through, blood pressure that suddenly crashes because the heart is too exhausted to maintain adequate pressure, an arrhythmia that briefly disrupts output. The classic scenario people describe is standing up too quickly and feeling dizzy, which can sometimes be simple dehydration, or a condition called orthostatic hypotension, where your blood pressure drops when you stand. But when dizziness is frequent, severe, unprovoked, or accompanied by chest discomfort or palpitations, that changes the equation entirely. There's also a phenomenon called pre-syncope, that terrifying moment where you feel absolutely certain you are about to faint. Your vision narrows, your hearing seems to tunnel, your legs feel like they belong to someone else. Your body is essentially trying to force you horizontal so that your heart doesn't have to fight gravity. It's a protective reflex, but it's also a screaming alarm bell. If you have ever actually lost consciousness without a clear explanation, fallen, blacked out, woken up on the floor, please seek medical attention the same day. That is never something to explain away. Your heart is extraordinary. Think about what it does. Beating 100,000 times a day, sustaining every thought you've ever had, every step you've ever taken, every laugh, every breath, every moment of your life. It is the most hard-working, most loyal organ in your body. But it is not invincible, and when it begins to struggle, it sends you these signs because it is trying to stay in the game. It is reaching out to you the only way it knows how, through a whisper of fatigue, a flicker of dizziness, an ache in an unexpected place. The tragedy is when those whispers go unheard, when we explain them away, when we wait for the scream before we act, because by the time the scream arrives, the options become much more limited. So I want you to do something today. Think back over the past few weeks or months. Have you noticed any of these signs? Unusual fatigue that doesn't match your activity level, nausea or indigestion that appears with exertion, a nagging ache in your jaw, neck, or back, shortness of breath that seems out of place, swelling in your feet or ankles, a heartbeat that feels irregular or chaotic, dizziness or near fainting. If any of these sound familiar, make that appointment. Don't negotiate with yourself. Don't say, "I'll wait until next month." Pick up the phone today. And if you have a friend, a family member, a neighbor, a parent, someone you love who has been brushing off symptoms, who keeps saying, I'm fine, please share this video with them. Because sometimes the most important thing we can do for the people we love is put the right information in front of them at the right time. Your health is your greatest wealth, not a cliche, the truth. Because without it, nothing else matters in quite the same way. Thank you so much for being here and for taking the time to listen to what your heart has been trying to tell you. If this video helped you, please like it, share it, and subscribe, because next time we're going to talk about the foods that silently damage your heart and the simple swaps that can make a real difference. Take care of yourselves. I'll see you in the next video.